My name's Cait, I'm 18 years old and I care for my mum, who has a few mental health problems.
Cait has been caring for her mum since the age of 7, and over the years, as her mum's mental health deteriorated, Cait's responsibilities grew.
When it first started happening, we used to live in a flat and we had a balcony, and she'd want to go outside, try to go over the balcony basically. She'd wake me up and we'd just sit there talking, trying to distract her from like the voices in her head. And sometimes like she'd go to sleep at about 4 o'clock in the morning and I'd just stay awake. And like I'd go around doing like housework or something because I was too awake by then to go back to sleep. But about by 6 o'clock, maybe 7, I'd be knackered again and as after sleeping, it'd either make me late for school or you didn't wear the right shirt for that day. And our school counsellor, she was like a learning mentor. She wasn't there to be a proper counsellor. She used to say things like, you're just acting out to get attention and stuff. And admittedly I was, but not for the reasons she's thinking of. She even knew that my mum had mental health problems because she asked me what was happening at home. And then she said, well, don't bring it into school. I was like, well, what was the point in me telling you? And then when I was 13 or 14, my mum had a really big nervous breakdown and she had to go into hospital. That first day that she was there, all we did was just sit in a room and not one person came in and had the decency to tell me what was going on. When she came out of hospital, it was even worse. And then there was someone who came round to see my mum. I just answered the door and I don't think she realised that like I was my mum's daughter, and she was like, well, who are you? I went, well, the person you come to see is my mum. Who are you? And she was just like, well, I'm from Multiagency, the crisis team. I was like, oh, hello. It's nice that you introduced yourself. None of them ever do. I was just about to walk out the room and she just like really quickly asked me a question. I was like, what was that? And she went, what's it like being a young carer? And I went, well, what are you on about being a young carer? I'm just here because it's my mum. She was like, well, I'd like to put you in touch with a place called Bernardo who's action with young carers.
That referral was a key moment in Cait's life. Her needs as a child with a parent with mental ill health were addressed. Bernardo's recognised the importance of taking a whole family approach and have been working with the LA and Merseycare Trust in Liverpool and the Social Care Institute for Excellence to help implement a Think Child, Think Parent, Think Family approach.
Cait's story is very unique, but also is often shared by many other young people who are growing up with parents with mental health problems. What happened with Cait was actually her mum was receiving services from adult mental health. Cait herself was trying her best to go to school, trying her best to get on with her life, but when her mum's health became so poor, that really affected Cait. And even though she did share that information with school, what didn't happen was, for all sorts of reasons, was that school didn't communicate with adult mental health services to start to think about what the roles were for both school and for adult mental health.
I began to get like quite depressed myself and I became quite a bad self-harmer as well. For me, that was my release. This was before I had anyone else. Well, before I thought I had anyone else.
For many children, they might, what we say, keep their head just below the parameters. Nobody's actually aware of it until it hits a crisis. And I think that's often because we have adult services that support adults and children's services that support children. And quite often, unless there's a bridge working across them, that those children get missed.
Liverpool has been an implementation site for the Sky Guide, Think Child, Think Parent, Think Family. Jane Weller, the Senior Improvement Officer for Carers at Liverpool City Council, has been working on bridging that gap with a variety of agencies, including Bernardo's.
My role is about identifying where the gaps are and where families are falling through those gaps, and to work across systems at basically plugging those gaps. Because where I sit within the local authority, I was able to draw on both adult and children's colleagues to develop a young carers assessment, because currently the thresholds are too high for a lot of children impacted by a parent's ill health or disability to actually access services within children's services, but this enabled us to actually navigate them across so that they could get the services and the support that they needed.
Although not all children of parents with mental ill health are young carers, supporting them is still important and has been a key area within children's services who've been improving awareness and protocols for referrals.
We've tried to help our schools to look for signs like very poor or patchy attendance, their parent or carer not engaging in the life of the school, perhaps that young person coming to school distressed or in an unkempt way, and then being able to escalate that up the line so that we're actually looking at services that can help to meet their needs. And what we've been developing is consortia of schools to look at solutions across that group, so that for Cait, for example, her needs that she was displaying in school around behaviour were just the tip of the iceberg. When you actually sat and worked with Cait, you would have found out that she had other problems at home, and that team around the school is a way of kind of getting the right level of support exactly where it's needed, so that there's no wrong door for a family, so that just because they go to one particular service, it doesn't stop there, but that service has the responsibility to say, let me help you towards somebody who can assist you in what you need at this particular time.
Before becoming an implementation site, the LA and its partners had always tried to take a holistic approach to dealing with parental mental health. Cait returned to the Broadoak unit where her mum was being cared for to talk to Service Director for Mental Health Services in Liverpool, Carol Bernard, about the family rooms that dramatically improved visiting times with her mum.
You couldn't really have any privacy because everyone else was having visitors as well, so you could hear all their conversations and fights used to go on and everything. Wasn't really very nice.
Can you explain to me how the family room has changed visiting for you?
It just gave us like a bit of time to me and her just to be like a little family again, because she couldn't come home. If it wasn't for the family room, then I probably wouldn't have really seen my mum much, because I would have refused to come really.
For people who experience mental health problems, maintaining links with their family and their children is of vital importance to enable their recovery. One of the ways that we as an organisation have tried to make sure that our service users can maintain the links with the family is to create dedicated family rooms within our inpatient services.
Taking a whole family approach to parental mental health has been a positive move for the local authority and Mersey Care Trust, who embraced the Sky Guide.
Since becoming an implementer site, Liverpool has established a strategic group to lead on the implementation. This is chaired by an Assistant Exec Director of Adults and Assistant Exec Director of Children's. And that was a really important thing to get across, really, that this is very much a shared agenda. And we felt that we were very much coming from a place of families and young people's voices.
Previously, in mental health services, we didn't always ask as many questions as we should have done about service users, family responsibilities and caring responsibilities. So we weren't always able to identify when service users had children under the age of 16.
What the Sky Guide for Think Child, Think Parent, Think Family has enabled the local authority to do is to take some leadership around the Think Family issue, and particularly around the care pathway for parents with mental ill health, so that we're able to identify parents and their young children at each stage of the pathway, from screening and initial contact with our organisation and other organisations within the city, assessment, that the care plans are developed taking the needs of the whole family into consideration, and then obviously the review, that they happen timely.
So for people who are in situations like Cait was experiencing, the care pathways now allow us to work much more collaboratively to make sure that we're looking at the needs of the whole family and that we are supporting each other in managing any issues, anxieties or concerns that come up for the family as a whole, and that we can use our individual expertise for the benefit of the whole family.
The difficulties in implementing that sort of approach are often difficulties that we have made, rather than from the service user point of view, who are only too pleased to have someone come to their home and talk about their whole family, rather than just a simple approach which is just about working with, say, their child. Because Problems that present themselves are very rarely just about one particular thing. They're usually about the whole life of that family.
One of the concerns from staff working in teams, particularly in adult mental health but also in children's services, is that we would automatically expect them to become expert in each other's business, and that's clearly not the case. What we want to do is establish a baseline understanding across all practitioners about the importance of think child, think parent, think family. What we've done about that is actually do some multi-agency training, and Louise Wardale from Bernardo's has been instrumental in supporting and delivering that training across the organisation. As a result, I think our staff feel far more confident in talking to children in the family home, talking to them when they come into the inpatient services and come to the family rooms, and it allows them to understand what their needs might be.
I was going to come in and talk to Bridget about finding me a job at some point.
Maybe we can speak to connections as well.
Yeah.
Although Cait has had her struggles in the past, because she was referred to Bernardo's, she's now receiving the help that she needs to look ahead to her future. With the Sky Guide in place, Liverpool is continuing its hard work using the recommendations for good practice.
What the Sky Guide has given us is a strategic mandate, a mandate to do this work. And for those resistant pockets, albeit getting fewer by the day, but for those resistant pockets and individuals, it's actually given us something to say, it's a must do rather than a we would like you to do.
I owe that worker quite a lot, and it's sad the fact that I don't know actually who she is or if she still works for them anymore, because I would just love to thank her for putting me in touch with Bernardo's and giving me all these different opportunities I can do, and she's just basically sort of given me my life back, really. I mean, I thought I was alone, but obviously because she was the only one who helped me, she actually took the time to help. Now I don't feel so alone anymore.